As a hospital leader, my biggest priority now is to take my very large hospital company and move it away from fee-for-service and get it onto a footing that is really evolved into value. So my job is to take our system and move it much closer to the patient in a way that they can access it easier, they can understand the quality, and that is much more affordable and relevant.
Massachusetts healthcare is magical. We have so many wonderful healthcare facilities within a short distance of each other. We've got mighty academic teaching centers, really excellent community hospitals, so that you don't have to go very far to get great healthcare. For me, what I love is my peer group. I am surrounded by so many intelligent, inspiring to me, dedicated and committed folks who are trying so hard to make healthcare accessible, available, and easy for our patients to navigate in Massachusetts. So I'm inspired every day by my colleagues and the people that I get to work with. And there's many, many of them in Massachusetts, and that makes it a wonderful place to be a healthcare leader.
I think the number one priority of healthcare has to be, we have to be able to take care of people safely. They come to us, they count on us to take care of them. They count on us to help them get well and go back into society at the highest state of healthcare possible for them based on their disease, and we should do that safely.
The role of the healthcare leader is evolving from the standpoint of how do we continue to work to be engaging? How do we engage the workforce? How do we actually think about what's happening not just in the present but in the future of the care that we provide? Folks that work in the hospital continue to change. Their needs are different from the needs that were 10 years ago, 20 years ago. How do we listen to that as leaders to actually work to provide the best health care that we can?
Some of the key issues in healthcare today are the cost of care overall. It's becoming really unaffordable for average families to pay their deductibles and premiums and that sort of thing. And also the fragmentation of our current system. Really the key in my job now as the head of the Bay State Health System is to pull together all the other leaders, our hospital leaders, our medical group leaders, home care, physicians, nurses, and get us working all in a coordinated way. Some people call this consumerism. I just call it treating patients well.
The key healthcare issues, both nationally and in Massachusetts, have a lot of similarities. From a local perspective, we have some of the world's best healthcare in Massachusetts. Unfortunately, it's also some of the costliest. And so one of the big drivers or big emphasis in healthcare in Massachusetts is obviously cost. How do we continue to maintain that high quality, but do it at a lesser cost, more affordable, and improve access, in particular with behavioral health and substance abuse for all of our citizens?
Healthcare in Massachusetts is special, I really do believe, because it is the center of health research, it's the center of health innovation, it's the center of health entrepreneurism, and it gives us as hospital leaders the opportunity to really flex our thinking. Very exciting things that I believe only can happen in Massachusetts.